Hi, I'm Dr. Ebrahim Moghimi. I'm so honored to talk about another interesting case study about infection after filler injection in nasolabial fold. This is a very important case that I like to share it with you. This lady was in dangerous situation after her first filler injection in her nasolabial fold. But we could treat her infectious condition after 3 weeks treatment plan. I will show you how the infection was diagnosed, how we injected hyaluronidase, how we plan to use antibiotics for controlling the infection, and the way we managed to debride the wound, and also how we could prevent any scar formation after healing the wound. I invite you to watch this video. I'm Dr. Ebrahim Moghimi. I am a general practitioner and teacher in aesthetic medicine, and also a consultant in aesthetic medicine for aesthetic doctors. I also have published many different books in Persian language for Iranian people and Iranian professional doctors in aesthetic medicine. I will be so glad to share my experiences about aesthetic medicine complications with you. If you need any consultation about your patients or about yourselves, I would be glad to answer to your questions. My email address is shown below. Please watch the movie. As you see in this patient, I need to talk about one of the most important signs that you may ignore in your clinical examination for any patient with ischemic complication after filler injection. That is no pain sign. What is no pain sign? When you pressure on the wound for defining any capillary filling process, you see that patient doesn't report any pain when you are pressing the wound with your finger. This is not because of the natural condition of the skin. It is because of the destruction of nerve roots after injection and necrosis, and the destruction of soft tissue under the skin. As you see in this patient, when we pressure on her wound, she doesn't report any pain. And this is not a good sign. But it may be a terrible, catastrophic sign of injection that says you have passed many days without any treatment. And this is the end stage of tissue healing process. Actually, the end stage of tissue life after your complicated injection. And you will be responsible for that. But there are many ways to solve the problem. We should be wise. We should diagnose any remained condition and plan a good treatment way, including antibiotic therapy, using hyaluronidase, and also wound dressing and wound irrigation for 3 or 4 weeks, as we did in this patient. You see, after pressure, patient doesn't report any pain. And you only see some tiny eruptions on her upper third of nasolabial fold with a small atrophic scar that shows a very, very small infection. But the sign that she does not report any pain should be serious, and you should suspect to a necrotic condition under the skin. In this patient, we suspected to the necrosis of under the skin tissue, and we tried to examine the site. But we didn't use any sonography device for finding any remained fillers in the arteries or any obstruction in arterioles around the facial artery. But the appearance of this sign shows that necrosis has been completed. We should know that after any obstruction, we may have a mottling sign because of ischemic event and because of decrease of blood circulation. And after the mottling event or livido reticularis, we may see a dusky color and also tiny pustular rashes on the side. These 2 signs are very critical and important for any aesthetic doctors, and you should write it on your notebook, and you should pay attention to it every day when you start your job at your office, because these 2 signs are 2 serious alarm for any infection after filler injection. This patient had both of them, tiny rashes with pustular contents and also no pain at the site. 3 days after her injection, this clinical sign was appeared. Remember that the patient was referred to my colleague, another doctor in another city, and she was injected by another unauthorized person who wasn't doctor. And my friend who was doctor tried to help her and referred her to me. And this photograph you see is about 5 days after the filler injection. And we saw that the nasal alae and also upper third of her nasolabial fold is encountered with a huge necrosis under the skin. And we suspected there would be a lot of pus under the skin. And when we examined the sensation of the skin in nasal alae and upper third of the nasolabial fold, the patient didn't report any sensation. And this is another sign of necrosis. So we should know that mottling or livedoreticularis is the first sign. Another is necrosis, dusky color, and another one is no pain, showing the necrosis of nerve roots. So we tried to uncover the skin, and in this reason we debrided the necrotic skin that without any pain and without any anesthesia, because there was no pain on the site. After uncovering the area and debriding the necrotic epiderm and derm, we saw a pustular area with yellow color, showing pustular content, and we irrigated this pustular contents with normal saline, and then we used local antibiotics ointments, and also we prescribed antibiotics, oral and parenteral, for 2 weeks. So we suggested her to inject antibiotics for the first 3 or 4 days, and also come to office for daily dressing and irrigation the wound. Because in these patients we should be very clever to clean the wound and to follow up day by day condition. If we neglect the patient situation may go worse, and in this critical site of nasal alae, any further necrosis may lead to nasal alae perforation, and this treatment cost is very high because we need some plastic surgery plans for flaps or reconstruction of the nasal area. But if we do as soon as possible to prevent any further necrosis or any further infection, we can prevent any destruction of nasal shape or nasal tissue. On the other side, we should also look for any scar formation. If we start prevention at right time and the right site with the right prescription, we can prevent any further scar formation. For this patient, we did on time, and the patient also was agreed with us for helping her. And this took us 1 week for the first stage of infection control with parenteral antibiotic and local irrigation and wound dressing techniques. And then the patient condition was better than better, little by little, day after day. In another slide, we will talk about other complication in this patient. We didn't talk about the brand of the filler. We didn't ask anything about the person who injected the filler. We only tried to help her and to control the infection because she needed help, and it was holiday for 5 days and there was no doctor to help her, but we helped her. For controlling any obstruction or any embolization process of hyaluronic acid, we tried to inject 100 units for each of these 3 points. Remember, we injected hyaluronidase 4 days ago when she first came to my colleague office. But after that, we noticed that the ischemic process was progressed from the nasolabial fold to nasal area. We couldn't talk about this, and we couldn't describe the result. She may had infection under the skin of nasal area, and after 1 or 2 days, the color of her skin turned to dusky. And it may not be because of an obstruction of the arterioles around the nasal area or in nasal region, but the important assumption was that there may be some obstruction, and in this reason we tried to inject hyaluronidase 100 units per any point, and this helped us to be comfortable with any suspicion regarding the obstruction of the circulatory system to the nasal or nasolabial area. But we tried to clean the wound and also irrigate any pus, and we also did this day by day along with the prescription of parenteral and oral antibiotics, and reassuring the patient that this will go better and better. And as you see, this is when we first opened the wound, and then this is 1 day after the irrigation and prescription of antibiotics. You see the lower half of the wound is cleaned and there is no pus, and the wound is the same color of around, but the upper part is active with pustular eruptions and also with two circular eruptions that was similar to vesicular eruptions of herpes infection. We also tried to prescribe her antivirus tablet, and after 2 days the upper half of her wound also was cleaned without any additional infiltration or pus secretion, and the wound color turned to a pinkish, active and live condition. This was reassuring for both of us, both for patient and us. And after 2 days, whitish collagen particles were starting to rise from the peripheral to the circular sides of the wound, and this was very reassuring. We saw the treatment was completing, and the vesicular eruptions resembling a viral infection were also fading away. This was 14 days after the first referral. So you say that it took us 2 weeks, day by day follow-up and treatment plan for preventing any necrotic, catastrophic condition of this patient. And you should be very, very careful with these type of patients. If you need any help, you should consult some other friends who are expert in wound control after filler injection complication. As you see, the whitish color of collagen cells are covering the whole wound, and this is very, very reassuring for us. After this stage, the epidermis will cover the whole wound, and we can use some other instruments such as silicone shields for stopping any scar formation at site. This type of shields are used for professional doctors, expert in controlling any bed sores or wound after accidents or wounds in the skin, and using them has its own protocols that is very, very extensive, and we use silicone shield, and this prevented creating any hypertrophic or hypo or hyperpigmented scars. You see the plans and the steps of this terrible patient when she first came to us after an unauthorized patient injection, and then you see the pus after wound debridement. We irrigated the pus and started our treatment plan with antibiotics, and we also needed some urinary days to reopen any suspected obstructed arterioles under the skin around these two areas of 1/3 of upper third of nasolabial fold and nasal alea. You see that the critical dusky color of the nasal alea show that this will destruct if was untreated, and it was very, very serious. But this patient was very, very pleased with the result of the treatment, and this practice took us 3 weeks of daily watching and following up the patient. The important case in this patient was that her face was not so white, and healing the skin was not very change of her skin color at the healed wound site. This is the complete stage of collagen formation, and after that we eventually decided to debride these two hyperpigmented tissues because we were worried about remaining them on the wound and creating two hyperpigmented points. And after the debriding, the smooth color of a white skin covered the wound without any hyperpigmented points. All of these problems arise when we are not acknowledged perfectly about the anatomical sites of the arterioles, arteries, venules, and we are not expert in injecting fillers, or we may ignore the sanitation processes and sterilization of the skin when we are injecting. These three factors may lead to a catastrophic infection after filler injection. We also should be aware about the filler quality, and we should be also aware of biofilm infection after filler injection. About biofilm, I will talk with another case in another video in this channel. I am Dr. Ebrahim Moghimi. I am also a consultant of complicated situation of filler injection or any cosmetic procedures that refer to me with professional active in this field. If you have any questions about your patients, if you have any complication in your patients and need help, you can inform me to my email address below, and I will help you as soon as possible with good result, with good co-workership with us. I also suggest you, after any infection, you should be clearly aware of any ischemic event in the skin color, skin tone, and some subjective or objective signs and symptoms from the patient. If the patient reports any pain after injection or her skin is pale, you should keep the patient at the office for 1 or 2 hours and clearly visit her condition. If he needs hearing aids to reopen the obstructed arterioles, you should inject and reopen the arteriole. In this patient, if the doctor encountered with any obstruction when he or she was injecting the filler, you could inject 1 dose alae and stop all the suffering for the patient. But I don't know, she was suffering from ischemic event or there was no ischemic event and the infection was occurred after filler injection, or the filler was infected, or the procedure was infected, or the patient had any oral infection that was disseminated from oral cavity to her nasolabial fold. There are 3 assumptions for filler injection. Oral infection of the patient's own oral cavity, or her sinus infections or dental problems. This is the first. Another one is the infection procedure that the injector may neglect the standard techniques. And the third one is the biofilm infection of the filler, or any infection in the filler itself. So after any injection, we should not neglect our client. We should ask her to send us her photo for at least 5 days after filler injection. And this helps us to follow up her condition, because some patients do not report any lividorecurrence or mottling because they are not doctors, or they don't report any infiltration or swelling or bruising because they think this is natural for them. But we as doctors should be very, very cautious about these signs and ask our patient to send her photographs for at week 3 days. So I hope this case presentation was helpful for your knowledge. I am Ebrahim Moghimi. I'm a doctor in aesthetic medicine. I'm also instructor of aesthetic medicine field, and I also work as a consultant, online or referral consultant, for any complicated cases after filler injection or after Botox injection, or any complication after thread lifting, or surgical procedure after any job you do at your aesthetic office. You can kindly send your question to me, to my address, to my email address, and I will help you as soon as possible. My email address is written in my content, and also I can give you my phone number in WhatsApp or Telegram for much more consultation process. Remember, you should be very clever about basic capabilities of working in aesthetic medicine. Basic capabilities includes anatomical knowledge, a whole anatomic knowledge regarding the muscles, regarding the derm and epiderm, regarding the subtissues, structures such as fat pads and lymphatic systems, and also arterioles and venules and nerve roots. And we should also be aware of any events after any injuries to arterioles or venules or arteries, or also nerves, facial nerves or other nerves that are in the face. We should also be aware about different reactions to different aesthetic brands. This needs more knowledge of pharmacology and anatomy in this field. Thank you very much. I invite you to visit my site and also watch my next videos in aesthetic complications. Thank you very much.